Well, good evening. It's my pleasure to be here tonight and to talk about sports science in Belval. This is not common, actually. I hope you not consider me as the black sheep. Before addressing the concept of precision health in sports injury prevention, I would like to explain to you first why sports injury prevention is also important for our society, for Luxembourg, and for health in general. It can be summarized in 3 points, actually. First, sports injuries will have direct impact, as it will interfere with the ability of the athlete to practice, to participate in training and competitions, of course. But sports injuries also have long-term consequences, as some of them may lead to a loss of healthy life years. Indeed, some injuries may cause permanent damage or chronic disability and functional limitations. And it's also important to be aware that sports injuries is actually one of the main reasons for people to stop sport practice. And last but not least, of course, sports injuries induce cost for the athletes, the clubs, and the society. So, a report on the burden of sports injury in the European Union was published in 2012, and it was estimated that about 1.8 million sports injuries were treated in hospital every year in the European Union. In addition, 2.6 million injuries were treated outside hospitals. 30,000 people suffer from long-term consequences of these injuries. And in total, the cost of these sports injuries was estimated to 2.4 billion euros per year in the European Union only. And this graph on the right shows that the majority of the injuries are related to team ball sports. And it's also interesting to note that majority of them actually occur out of an organized competition, organized training by the clubs and federations. So to tackle this burden of sports injury, Willem van Mechelen presented this sequence of sports injury prevention. In the first step, we aim to describe the extent of the problem. The second step, we investigate the etiology, try to understand the mechanism of sports injuries. The third step concerned the introduction of preventive measures, while the fourth step allowed the assessment of the sports injury, assessment of the effectiveness of these preventive measures. Now, I would like to say a few words about Sir William Thomson, alias Lord Kelvin. He was Scots-Irish, mathematical physicist and engineer, and is well known for having determined the correct value of the lower limit to temperature as about minus 273 degrees Celsius. And Lord Kelvin also made this interesting quote: "If you cannot measure it, you cannot improve it." Of course, some economists add it, and you lose money. Now the question is, how can we measure sports injuries? How can we collect relevant information on sports injury prevention? Our group conducted the first project in sports injury prevention at the Sportlycée in 2007. And at that time, all school children had to report all their sport practice, duration, intensity, and injuries on a daily basis in this diary. Then, the research team had to encode all the data in Excel spreadsheet. So it was really suboptimal for both the participants and the research team. As of 2011, we start developing this web-based data collection platform called TIPS, Training and Injury Prevention Platform for Sports, in which actually it's just a sport calendar in which the athletes can easily report every training sessions, competitions, and also injury, pain, and illness. Among other, the systems could provide some feedback on the training load. So this system was developed by our team, especially for the follow-up of study participants in project on sport injury prevention. This is an example of a report. This is about to report a training session. And this is the form that was used to report an injury by the participants. The system was far better than the paper form, but the data has still to be manually reported by the participants. which is a real burden for the participants, and it increased the risk of dropout. You already know that the wearable technology has largely improved over the last decades. Many sensors covering a wide variety of information are available today, and globally these systems are quite light, they are user-friendly, they are accessible to most people in Europe, and on top of that, these sensors, most of these sensors are connected to your smartphone. So the data is in your pocket. We have shifted from an era where the challenge was data collection to an era where the challenge is actually data analysis. Now I will try to explain to you why precision health is also important for sport injury prevention. And I will mainly talk about running because it has been one of the main research topics of our group over the last decade. Let's say that among all runners, there are 3 subpopulations based on their running experience. Then, running 15 kilometers per week may be safe for population B, but population A and C may be at high risk of injury because of their lack of experience in running. We could give a general recommendation to these runners to limit their weekly distance to 10 kilometers per week. In that case, the recommendation will be safe or appropriate for population A, but it will not be needed for population B, and it may not be sufficient for population C. So this means that we have to stratify the population to investigate which preventive measure is appropriate for each of these subgroups. Now, we're going to apply tailor sport injury prevention to running shoe technology. This is the first documented footwear. It was found in Oregon, and these shoes date back to 10,000 years ago. Running shoes are thought to play an important role in injury prevention in running. This popular belief is very strong actually among runners. And that's why we conduct a series of randomized trials to investigate the effect of specific shoe features on injury risk, mainly among leisure time runners. In this first study, we investigate whether the motion control system can help preventing running-related injury. A motion control system is meant to control pronation, which refers to ankle leaning inward or flat foot if you prefer, which is considered as an important risk factor. So in this study, based on the foot posture, the participants were randomly allocated to one of the study groups. In one group, they receive a pair of motion control shoes. In the other group, they receive a pair of neutral shoes, the reference shoe. And the participants were followed up over 6 months. And we observed that in the whole group, globally, the risk of injury was lower in the group of runners who received the motion control shoes. So this graph shows the cumulative risk as a function of the volume of exposure, so the number of hours of running. The lower the curve, the lower the injury risk. The question is whether this shoe technology is a one-fits-all preventive measure. So let's have a look at different categories of runners classified according to their foot posture. And we observed that among people with pronated feet, motion control shoes were effective in lowering injury risk, while motion control shoes were not harmful for the others. So in a nutshell, the motion control shoe technology is beneficial for those with pronated feet, and it's not detrimental for the others. Another popular shoe feature is the heel-to-toe drop. That's the difference in thickness between the heel and the forefoot of the shoe. And in this study, we compared 3 different versions of the same standard cushion shoe with a drop of 10, 6, and 0 millimeters respectively. We stratified the population according to running profile in this study. And among the occasional runners, we observed that those who received the low drop shoe versions, the shoes with a drop of 6 and 0 millimeters, the risk of injury was lower. Opposingly, in the group of regular runners, the risk of injury was higher in those who received these low drop shoe versions. So an opposing effect of shoe drop on injury risk was observed in these 2 subpopulations of runners. And recently we conducted a large randomized trial on the effect of shoe cushioning on injury risk while taking the mass of the runners into account. Actually, there are many popular beliefs in running, and one of them says that heavier runners should use running shoes with greater shock absorption properties to prevent running-related injury. So in this group, in this study, we classified the participants according to body mass. More than 800 leisure time runners were included in the analysis, and the distance covered by the participants in the study shoes correspond to running around Earth more than 5 times. And we observed that among the heavier runners, actually there was no significant difference between the two study groups, between the two shoe conditions. But among the lighter runners, the risk of injury was lower in those who received the soft shoe version, so with greater cushioning properties. So cushioning may be a protective effect for running-related injury, have a protective effect for running-related injury, but only in light runners. Now the question is there enough scientific evidence to support the prescription of running shoes for as a preventive measure? And unfortunately, I would say no. First, there is a lack of high-quality RCTs. And the few results I showed you today have still to be confirmed. Second, in recent studies, we demonstrate how shoe cushioning may help prevent running-related injuries, but most of the mechanisms have still to be uncovered. Then, as researchers, we usually seek for a global effect, a difference between experimental groups or between shoe conditions, but every runner is unique and may react differently to a given shoe feature, to a given pair of shoe model. And this specific response may not systematically translate into a significant group effect. And last but not least, we should bear in mind the real role of running shoes, the role played by the running shoes in the causal path. Some of you may have currently running shoes. Don't worry, you will not sustain any running-related injury tonight, because you need to practice running to develop a running-related injury. So the running shoe will only modify the training load an athlete can tolerate before developing the injury. So in research, the quality of our work highly depends on the quality of data. We cannot compensate for a lack of accuracy in the raw data, for instance. We cannot extrapolate on data we do not collect. And in sport injury prevention, monitoring is key, especially training load, because this is the main exposition to the risk. We need accurate monitoring of training load and to be able to detect some change, acute change in training load. But we also have to monitor the athletes on the field. For instance, this running technique analysis performed in the lab on this instrument, a treadmill, may only be partially representative of the real running technique of the runner in its natural environment. So we don't have the knowledge to determine which shoe model better suits a specific runner based on his body mass, foot type, experience, preferring distance, and so on. There's still a lot of work to be done, but the technology may help. And actually, we are working with the CHL and the IEE to develop a new wearable device to monitor closely gait pattern in patients in their daily life activity. And actually, this technology may be helpful for runners too. It may help identify what shoe features or what shoe model better suit their running technique or their foot. So tomorrow, the technology will provide us with the data we need for more precision in sports injury prevention.
Thank you, Laurent. Very nice, impressive studies and findings. I'm intrigued by the heavy runners that didn't benefit from the more cushioning. Do you think that's because maybe they are by nature more, let's say, cautious runners because they know they are at risk and therefore maybe they don't go for the same speed? Did you take into account maybe, I don't know, speed of running or anything as a confounder? Is that a possibility, or what is your explanation for this first counterintuitive results?
Indeed, it was surprising. And you're right, we control for many confounders, and speed was one of them. There are different aspects. First, we may think there is a trend the curves are not in the opposite direction as with the shoe drop. So we may think that maybe it's a problem of sample size or statistical power, but still it's far from a trend. So the study is randomized for the shoe feature. Of course, we cannot randomize for body mass. So there might be other difference in these two study populations that may explain why we find the effect in one group and not the other one. You're right. Now, of course, I have talked also with the engineers who developed the prototype for the study. There might be something related to the mechanical properties of the foam because the behavior is not linear. So in theory, it's plausible that there is a right zone of cushioning depending on the mass of the runner and the running technique, of course. As I said, there are many things we don't know.